Hello, everybody, and welcome to today's live session with OET. My name's Scott. I'm the Academic Director at Swoosh English. We're an online premium preparation provider for the OET exam. And once again, thanks a lot for coming along today. Sorry for the slight late start. Just making sure that everyone could watch this video today. I didn't want to make sure that any of the streams weren't working because you're all here to watch some OET live essential skills for Part B, Part B class. So wanted to make sure that everyone was able to watch that class before we began. So yep, once again, thanks for your patience and sorry for the delay. And once again, welcome to today's class of OET Reading Essential Skills to Part B. Let's see who we have in the session today. We have Sonny Baby. Hello, Sonny Baby. I said good afternoon. Good afternoon to you too. We have Leandro, has tagging her friends. That's amazing. We have Frankie says hello from Malaysia. We have Sharzad has said hi. Hello to Sharzad too. We have Atalachi has said hello. We have Simi has said hi, Scott from Kuwait. Hello to you too, Simi. And hello, Cheston from the Philippines as well. Let's see who we have over in the OET YouTube feed. We have Kieran, we have Maya, we have Shrikala, we have Salman, we have Aparna, Joker, Divya, Jaren, Rinumol, Juliana, not Juliania. Pronunciation, Scott. Let's get it right. We have Dr. Mohammed. We have Kasia. We have Nanda. We have Palu Thanon. We have Chris, Pineapple, and Anna Sena. Welcome to the session today, everyone. And thanks a lot, of course, for coming along as well, guys. Thank you so much. So anyway, let's get started with today's session. I'm looking forward to having you guys in the class. And make sure, of course, that you say hello and you get involved with this class as much as possible. But I want to get straight into the class and begin doing our live session today, which is OET Skills Essential Reading for Part B. Looking forward to getting started this session today. So what are the aims of today's session? Well, we're going to do a mini quiz on reading Part B to test your knowledge and see exactly what you know about the OET Reading Part B exam. We're going to go through a walkthrough of some sample tasks with 3 steps to success for OET Reading Part B. I'm going to practice a few methods that are going to assist you in scoring higher in this section of the exam. And we'll finish off today by doing a mock exam with a bit of feedback as well on why the answers were what they were, so you can apply what you've learned in today's session today. And if we have some time, we'll go through a brief Q&A where you can ask me about the content of today's class. You can ask me about how Swoosh English can help you pass your OET exam the first time. Make sure, of course, you also stay to the very end of the class, as we like to reward people coming along to watch this official class today, where we'll give you an opportunity to get 20% off your Swoosh English OET preparation courses. So make sure you stay until the end to find out some more information about how you can avail of that special offer. So guys, I want to now know a bit more about you. What do you plan to do when you pass the OET exam? So you're all doing this exam for a particular reason, but I want to know more about you and why you're taking the exam and what you want to achieve from passing this exam today. So please let me know, guys. What do you want to do when you pass your OET exam? While I'm waiting for some of those comments to come in, I'm going to say hello to a few more people. We have Alexei, I said hi, greetings from Dubai. We have Kimas, I said hello, Scott. Hello to you too, Kimas. We have Claire. Claire said hello, Scott, and everyone watching to learn. Well, thank you very much, Claire. No pressure. Enjoy the rest of the session today. Manju has said hi, good afternoon. Hello to you too, Manju. We have Pawan has said hello, good afternoon. And we have Vignesh has also said hello as well. Let me know, guys. What do you want to do when you pass your OET exam? I want to know a few comments. I want to know your big dreams and your big reasons for doing so. So Jeanine McTingy, I think that's how you said, apply as a work as a nurse in the UK. Salman wants to work in the UK as well. Aubrey says, hello, Scott. Kieran says to work in Ireland. And Pinkwit and Raja said to register to the IMC. Sonia wants to work in the UK as well. Fantastic, guys. So everyone wants to do this exam to improve their lives in some way. You want to move to the country of your dreams. You want to increase your salary in a new position. You want to learn new skills in a new position. Maybe use those skills or take them back to your home country. Maybe you want to experience a new culture and see what it's like living in a different country. Maybe you also want to, of course, see some family and friends and live there with other people as well. Vignesh has said planning to move to the USA for a fellowship. Very interesting. Alexei has said return to the medical profession and move to the UK. Lovely. And Paolo has said I will apply as a nurse to live in the UK. Guys, keep those comments coming. I love reading those comments today. Ranita has said, hello, Scott. Hello to you, Ranjita. Thanks a lot for joining us. So, guys, thank you very much for those. I'll read some more of these as we go through the class. Now, some people say that OET reading part B is the easiest part of the OET exam. After all, the format is a bit shorter and it's a lot less high stakes than part A and part C, for example. But it's still important to practice your OET reading part B because no part of the exam, I would say, is easy. So I want to know, what is your biggest challenge with OET reading part B, guys? Let me know in the chat box. What's your biggest challenge with OET reading part B? What do you find difficult with this part of the exam? Please let me know, guys, in the comments. I know to everyone on the Facebook channel as well. Navita said, I'd like to work in the UK. Anisha says to work in the UK. And Chitra also says hi as well. Keep the comments coming in, guys. Keep them coming. So, guys, let's see. What's your biggest challenge with reading part B? Throw your comments in, please. Solomon has wisely said it is easier, but not the easiest. Correct. Of course, it might be the easiest, but it's certainly not easy. And lots of people are telling me about their GMC and their PLAB registrations. That's lovely, guys. I'm looking forward to seeing more about that information, okay? Now, Vina Sheila said, questions regarding views about the conversation. Right, inferences, shades of meaning, what the right answer might be according to looking around the text and the wording involved with it. It's quite difficult that way. And Paolo has said it's time consuming, okay? It's an expedited task. It doesn't take as long as the other parts, but it definitely can be quite time consuming if you don't obviously hit it on its head, which is very, very, very important. Nikila has said confusing options. Hopefully I'm not doing my OET speaking test anytime soon, guys. I'll be getting really bad marks on my pronunciation. I'm going to want to laugh at my own jokes, by the way. Anyway, so yes, people have their ideas about what is difficult with reading part B. It's the time management, confusing options, and reading around shades of meaning in the languages. Sharzad has said the answers are too close and it's challenging to differentiate between them. Right, we're going to go through a bit of practice of that today. So how you can analyze some of the key words and key meanings behind all of this. Okay, guys. So let's start off with the quiz. I want to know exactly what you guys know about OET reading part B. It is essential, of course, that you know the format of the exam really, really well before you go into the exam, so you know exactly what you have to do on the day. So regardless if you're new to OET preparation or you've been preparing for a while, it's still good to either learn the format of the quiz or to just consolidate your knowledge about what to expect on the day of the exam. Let's get started. So first question is, how long is reading part B, guys? How much time do you have to do for reading part B? You're going to be commenting today a lot in the chat box and in the comment threads of your Facebook or the YouTube feed. So throw in your answers, please. Looking forward to seeing reading part B quiz. What is difficult? Regarding how long it is, sorry. So a few other people making comments about what they think is hard about reading part B. Abby Sana said, I get confused with many options. Simi has said time management. Cheston has said equally plausible options. All of these are great. Okay, Simi has said 12 minutes. Alexi has said 45 minutes for B and C. Keep the comments coming in, guys. Some people are saying 12 minutes. Some are saying 13. Some are saying 12. Some are saying 22 to 23. Keep the comments coming in, guys. All right. Let's lock in your answer, guys. Keep a note of your answer. We're going to do a bit of a quiz today. Question 2, how many exercises are there? Okay, so how many exercises are there for reading part B? Let me know in the comments, please. Let me know how many exercises there are, sorry, in reading part B in total. Okay, Alexi has said 6. I can only show comments of those who are on the Swoosh English page today. I can't show the comments in this feed, people who are on Facebook, OET Facebook and YouTube, but I will try and say them. Vignesh has said 6, Simi has said 6, Abby has said 6, Ranjita has said 6, Teresa has said 6, Reti has said 6. Everyone else is saying 6 as well. Okay, hope you're all right, because if you're not all right, you're all wrong. Anyway, question number 3. How many texts will you have to read on the day? Could be linked to the previous answer. So there are 6 different exercises, but how many texts do you have to read? Throw your comments in once again, guys. Thank you very much. Okay, Sini has said 6. Noemi has said 6 on Facebook. Arokia has said 12 minutes. Okay, everyone once again is saying 6, 6, 6, 6, 6. Right, let's lock that answer in. Question number 4, what type of task do you have to complete? As we know, reading part A, B, and C are all somewhat different in what is required of you to do. Who can give me in the most detailed language possible in terms of what type of task do you have to complete for reading part B? Think about what you have to do in the day. What is the type of task that you have to complete? Let me know in the comments, please, guys. Let me know. Might be a slight delay coming through today. That's fine. I'll just wait and read some answers as we're coming in. Think about it, guys. Reading part B, what kind of tasks do you have to do on the day of the big exam and doing your preparation? Abby has said the gist of the paragraph. Okay, thanks for your answer, Abby. Anyone else got anything else that they want to do? Vipul has said a memo. Interesting. Okay. And Nifu has said an MCQ, a multiple choice question. Okay, let's keep those answers at hand. Finally, the final question for our reading part B consolidation quiz or learning quiz if you're doing it for the first time. How many marks are there for reading part B? Let me know in the comments, guys. There are 6 exercises, 6 texts. How many marks do we think there might be in total? Ramiz has said for the previous question, a multiple choice question. Right. Okay. Some people are saying understand the text. Some people are saying gist and purpose, etc. as well. And everyone here is saying 6 marks, 6 marks, 6 marks. Okay, guys, let's lock the answers in. Let's see what our answers are. How many did you get correct? How well do you know the format of reading part B? So how long is reading part B? It's about 12 minutes or so. I say approximately 1 minute per question. That's 1 minute to do your reading and compare your answers, but you have up to about 2 minutes. I say a minute because if you can do it in a minute, that will give you more time for part C. But of course, you can use your time wisely and use up to about 12 or so minutes for reading part B, as you want to dedicate the rest of your time to this to reading part C. So 1 to 2 minutes per question. So about 6 if you're very good at reading part B, to 12 minutes as standard. How many exercises are there? There are 6 exercises in total. You know it well. And there are 6 texts you have to read. There's 1 text per question. The texts are all relatively short, so you should be able to skim through these fairly quickly. Question 4, you have to complete 3 answer multiple choice questions, which many people have said here, and they are on short healthcare workplace texts. So all of the texts that you have to read will be memos, there'll be procedures, there'll be policies, there'll be emails, other forms of documentation, or extracts in a workplace conversation, and you have 3 multiple choice answers to for each style of question. Some people are right in saying, yes, you have to pertain to detail, main points, and gist are the 3 different types of answers that you'll have to do. And how many marks are there in total? There are 6 marks in total for this section. So yeah, the stakes are low compared to part A and part C. Still really important that you maximize every single area of your OET exam, because if you have a bad day in your OET reading part A or C, but you have a really, really good day in your part B and you get 6, that could still push you up to a B. So you make sure you do every section incredibly well. Okay, guys, well done for those who got the answers right in that quiz. We're going to go through 2 example tasks today, guys, and we're going to highlight a few strategies and essential skills that we're going to look at to hopefully help you think about the way in which you go about completing reading part B. What's your strategy? What do you have to look out for, etc.? So here's our first example task. As you can see up here, we have our multiple choice questions, and we have our short text in total. You'll see 6 of these on the day of the exam. So what's our first essential skill? Well, regardless if we are doing a gist style question or not, it's really important that we still acquire a sense of gist of the texts and the questions, because it can really, really assist us, of course, on the gist style answer questions, but gives us a good idea about what the text is about, and that can help us when we're still searching for the answer options, and can maybe help us locate the answers better depending on the style of question that there is. Now, how can we do that? How can we acquire a sense of gist of the texts and the questions? Well, here's our first example text, and we're going to look at a few things that you should look at straight away and take a note of. Now, of course, the text is 100 to 150 words. They are relatively short, so you can fly these fairly quickly, but you still don't have time to read these texts in a lot of detail. Now, what you want to do is, of course, skim to get an idea of the gist is always useful. Now, how can you do this? How can you locate the gist of these short texts relatively quickly in an expedited way? Well, the things you should look out for include these, this and these, which are the headings and topic sentences. These will give a very good idea about what the text is about. The first heading says pediatric discharge. Okay, so we now have an idea about what this procedure is about. And the first sentence says, it is a policy of this hospital that upon their child's discharge home from the unit, all parents will receive written discharge advice about their child's hospital stay using the admissions, discharges, and transfers navigator. So that gives an idea about what the text is about. That can be very useful when we're looking at main point or gist. We can usually find that information at the beginning or else throughout the text. That can help us with 2 out of the 3 questions, but also gives us a good understanding about what is coming next. So make sure you always have a look at the heading and the topic sentences to take a note about what the text is about. You even spend about 10 seconds or so, 10-15 seconds doing that. Reading through, skimming and scanning, taking a mental note about what the text is about. The second thing, of course, we should do is, of course, analyze the question. So very quickly, look at the text options. Skim the headings, skim the topic sentences. Then we should analyze exactly what the question is getting us to do. So here we have the question. As we can see, every single question in reading part B is a sentence completion type. So the question extract and the 3 answer options will all be part of one sentence. You are joining the gaps together. 17 says this extract from the policy document aims to ensure that, and then we have our 3 answer options. So there are 3 answer options, and they're all potentially correct, by the way. Sometimes in the reading part B texts, there will be answers which are just not alluded to whatsoever. They are not alluded to, so you can very easily eliminate them. But usually they are referenced in some way. But does the meaning exactly join up with what the question is asking? And is there any wording in the answer options which doesn't make it an exact fit? That's what makes reading part B somewhat challenging, because every answer option usually can be a potential answer. So we'll do some more about that very soon as we go through more examples. Essential skill 2 today, of course, is analyzing the question and the answer option keywords carefully, so we can ascertain which ones are the best options based on our understanding about what the question is asking us and what the answer option keywords are telling us as well. So here is our question we're going to look at today before we analyze the text in a bit more detail. What should we look for? Well, meaningful words, of course, are nouns, are verbs, are adjectives, but other words which actually suggest a shade of meaning or make an inference. Usually those are done with modals. So modals are other adverbs of frequency, for example, which indicate how likely something is to happen, how much of a fit it is. There's going to be a few of these answer options here. Let's analyze them. Let's analyze the rest of the keywords here too. So let's start off with the question. We have an extract. So we know it's an extract. It's a policy document, and it aims to ensure that. So what is the aim? That might suggest about what is the gist or what is the main point of this document, and ensure. So something that is definitely going to happen. Anything in the language which suggests that something is definitely going to happen through this document. Answer option A, appropriate software to use for discharges. So something that is appropriate. Software, so that's obviously something that's done on a computer. Use and for discharges as well. Will this wording be used and alluded to? B, families are fully informed. So fully is a word which suggests meaning. It's an adverb which suggests, is it fully, partially, or not at all? So once again, a word that has a shade of meaning. make sure the answer options suggest something is fully informed. And once again, of discharge arrangements. And then in C, the role of the clinician in discharge clearly understood. Clearly understood. So once again, we got another adverb which would suggest shade of meaning. So something that is clear, that is trying to emphasize that something is definitely, clearly, and certainly going to be understood. So as you can see, of course, underlining our keywords, our nouns, our verbs, adjectives are important, but other words which suggest a shade of meaning or degrees of something is happening. So appropriate, fully, and clearly would be the words in this extract. We also have ensure up here in the question itself. So think about that. From analyzing this, it looks more than likely the type of question we're going to have to answer here and the points you're going to have to get in the extract are going to be a main point or a gist style question. So those headings and subheadings, as well as the entire meaning throughout that text, are going to be very, very important based on the wording of this text. Okay, so we looked at the question. We've analyzed some of the keywords. We now have an idea what we're going to look for. Essential skill 3, the longest essential skill, is going to be knowing what to look out for when we're answering the questions itself. Let's go through a step-by-step process about what we should do when we're looking through an answer option, OET reading part B extract. So here we have the question up here on the left-hand side, and here we have the text here on the right-hand side, the one that we looked at earlier. So let's have a look through. A, as it said, the extract from the policy document aims to ensure that the appropriate software to use for discharges. We analyze those keywords, appropriate software used, discharges. Let's start reading through and see if we can find anything that alludes to that. Okay, we have here, discharges and transfers ADT Navigator. The AVS includes a minimum data set, blah, blah, which incorporates names of consultant diagnosis. Now, something is mentioned here, admissions, discharges, and transfers navigator, the AVS. Now, it is mentioned, but one, is it considered a central aim? Is it aimed to ensure that they use the appropriate software for discharges? I'm not so sure. I'm also not 100% sure if the ADT or the AVS is software. So I'm going to put a question mark there based on that, because this is what alludes to this point, but it's not exactly clear if it's the main point. Does it ensure something? And also, is it really software? I'm going to put a question mark beside that. Let's now look at B. Families are fully informed of discharge arrangements. So we start to analyze this. Okay, let's look at our topic sentence. It is a policy of this hospital that upon their child's discharge from home from the unit, all parents will receive written discharge advice about their child's hospital stay using the admissions, discharge, and transfers navigator. Right. So it's referred to in the text that families are fully informed of discharge arrangements, and it appears in the topic sentence. Therefore, that could be a main point. So far, it's the best fit for a gist style question at the minute. To me, it's a better answer option than A, sorry. But I can't be sure yet because I want to see if I can analyze C very quickly and see if I can eliminate that answer or find something that works better for that. So let's now have a look at C. The role of the clinician in discharge is clearly understood. Okay, well, we can see the final sentence involves the word clinician, so this section will be relevant to that. Clinicians should also document in the progress notes that the discharge advice has been given to the parents and the time of discharge. Okay, so it doesn't really mention anything here that obviously a clinician is mentioned. It's talked about their role, but it's not really mentioned that their role in the discharge is clearly understood. It talks about what the parents should do, but not what the clinician should do. So based on that, a question mark. So I've looked at all the answer options. I've kind of said that A and C don't really constitute a gist or a main point, whereas B does, and it's also referenced in the very first sentence. So based on that, B is our answer. It's referenced at the very, very beginning. It is in the topic sentence, clearly the gist and clearly a main point. And it is the most accurate wording that has been used here. So based on that answer option analysis, we can see that B is the correct answer. Hope everyone else came along to that conclusion with me as well. Okay, I'm going to make the screen slightly bigger I'll take away my face for a while so people can see this appropriately. Maybe you're using phones or you're using tablets or other small screens. So yep, I'll take away my face and we'll just go through the same again here for example task number 2. Hope that helps everyone. Sharzad, hope that helps you especially. Okay, here's example task number 2, second text. Okay, let's go through our procedure. Remember to skim the text and take a note of headings and subheadings and topic sentence for the gist. Let's have a look at that now. So as we can see, our heading is patient care handover procedures in the pediatric ward. So we've got an idea about what this is about. And look at our first sentence. Handover should occur by each patient's bedside. If this is not appropriate, it should occur outside the patient room, and if available, parents are encouraged to participate in handover and must be aware of the plan for their child for the next shift. So we got a patient's bedside has been mentioned. We should talk about outside room. Parents should participate and they should be aware of a plan for the next shift. Okay, could that allude to our answer next? We'll soon see. Let's have a look now at our keywords. Can we analyze them? Can we highlight the content words, the nouns, the verbs, the adjectives, and especially those important modal words which make inferences and also give shades of meaning? So let's have a look. Guidelines say about the handover of pediatric patients. So once again, what do the guidelines say about the handover of pediatric patients? As we can see, the first sentence and the topic, question topic, talks about handover procedures. Once again, more than likely, there's going to be a gist or a main point style question. We can see by the wording in the questions. Okay, so it said this should take place at the bedside. Okay, keyword should. So giving an instruction here, take place at the bedside. B, parents need to be involved or fully informed. So what the parents need to do, and also the word fully being used here, informed about a civic procedure. And then C, notes may is very important because that's making a suggestion. Okay, something could allude to it definitely being done or never being done, etc. So may is suggesting a suggestion or a somewhat likeliness of this happening. Be made in either electronic or handwritten form. So either would suggest one or the other. Both are fine. Sometimes the questions might allude to electronic only or handwritten only. Some people will analyze those words and say, okay, electronic or handwritten. Oh, I can see that's been written. That's the answer. We're reading around ideas, guys. We're reading around sentences, complete ideas and complete chunks of the text, not just trying to find the first word that we see and think that word's there. I'm going to answer that option. So make sure you pay attention to important words like modals or other words which may suggest options as well. Okay, let's start to analyze now our answer options. So I put down A as a question mark, and the reason why it said this should take place at the bedside. Well, the very, very first sentence does say handover should occur by each patient's bedside, but it's a very short sentence, right? I know it's in the topic sentence, but it's very short and there's no other information that really surrounds that. So I'm going to put A down because it's mentioned topic sentence, but is it considered the central point or the main gist? We're not yet sure. So it's a potential option. It doesn't really give me a lot of information about what do the guidelines say about handover pediatric patients. Is it a main point or a gist? Okay, now let's have a look at B. So parents need to be involved or fully informed. Let's look. Well, once again, it goes through here. Handover should occur by each patient's bedside. If this is not appropriate, it should occur outside the patient room. And if available, parents are encouraged to participate in handover and must be aware of the plan for their child for the next shift. That's looking quite good so far. I think some of you guys will agree. It's referenced and it seems the central point of the title and the topic sentence. So for a gist or main point style question, that's looking quite good. And we have certain words that are being encouraged. Parents need to be involved or fully informed. If available, parents are encouraged to participate in handover and must be aware, need to be fully informed. So we have wording which aligns with what's being used here. We have the modal must, which means an obligation, and we have need to, which is actually the equivalent of must as well. Aware of the plan for their child for the next shift. So B's looking quite good so far. Let's put a question mark for now before we analyze C. So C, it says, notes may be made in either electronic or handwritten form. Is there anything here that suggests that? Well, it says here, handover must be completed in the ISPAR format utilizing the handover function, electronic medical EMR, and recorded therein. Right, so I'm not sure about that one. I know it's mentioned, but I'm not sure if the ISBAR format is handover function. Is it electronic? Is it handwritten? It looks to be electronic, but I'm not 100% sure about that, right? So because I'm not sure about that, and it doesn't really allude to the main point, I'm going to say that C is probably not a very good answer option overall. Nothing tells me that it's either electronic or handwritten form, and it's not really a main point. So based on that, and based on our previous reading, we can see that B is the correct answer again. We can see that the wording is fully synonymized, of part B, need to be involved, must be aware of the plan for their child, and it's mentioned in the topic sentence. So we can actually eliminate the other answers and put down B as our correct answer. So hopefully everyone was able to come to the same conclusion as me based on that. Okay, guys, that was a bit of a walkthrough, some of our essential skills for reading part B. Let's have a look now at a review of some of these skills. And I'll say hello again. Hello, I'm over on the side of the screen again. So when we're doing part B, make sure, of course, we learn the format of the exam section. We know exactly what we're doing for reading part B. Most people here today showed me that you were able to do that incredibly well. Learn the format if you're new to the exam. Remember to start by very quickly skimming the text to get an idea of the gist. If we do have an idea of the gist, then we're going to be very good, hopefully, at main point and gist style questions. Yes, there are detailed questions as well, and that involves obviously scanning and finding precise details, but getting a sense of the gist can help in every regard. As I mentioned, the answer could pertain to gist, detail, or the main point. Make sure we're aware about how to go about the strategies at each of those sections. Highlight your question answer options keywords to improve your accuracy. Highlight your nouns, your adjectives, your verbs, but especially words like modals and adverbs, which give shades of meaning. Is it an obligation? Is it a request? Is it advice? Is it certainly going to happen? Is it somewhat going to happen? Is it never going to happen, etc.? Reading around those keywords are very important. Go through the three options to both identify potential correct answers and eliminate the incorrect answers. Remember, don't just simply read through the text. Oh, I see that word there. It's the same word as the text. That must be the answer option. Part B is not about expedited extraction of detail. We're supposed to be reading around key ideas and reading around key words and knowing where to read, etc. So make sure you're reading around ideas. You are ascertaining your answer options while simultaneously eliminating the incorrect answers, a bit like what we just did there in the previous two examples. Assess the best answer option based on your analysis. If it's a main point question, which of these relates to the main point better and which one doesn't, etc., etc. Can I eliminate any because the words haven't been referenced, they haven't really been shown, etc., etc. And be aware of distractors and inferences. Just so you know, OET will put in some distractor options. So they will put in a keyword that will be designed to go, those people who are looking for a keyword, they'll put a word in, you'll see that word and go, oh yeah, that's the answer, that's clearly it. But if you kept reading, there would have been something afterwards which would have eliminated that as the correct answer. So be aware of these distractors and be aware of these inferences and these false inferences as well. Reading around keywords, the shades of meaning, your modals, which ones make the most sense is really important. And then finally, of course, practice makes perfect, guys. Keep practicing, keep practicing, keep practicing. Analyze your answer, see what you did wrong, see how you can go about it doing right. Make sure you're getting tons of great feedback from quality premium preparation providers, of course, and you're doing constant mock exams and giving yourself enough time to practice. That's what will see you getting your scores eventually up to the level that you need on the day of your exam. So guys, we've done a few example answers. Let's now practice with you guys and see how well you've come on with learning some of those techniques today. We're going to do a mock exam. Let me know if you are ready to do a brief mock exam. Let me know in the chat box if you are wanting to do a mock exam. Please say yes. If you say no, it doesn't matter. We're going to do a mock exam anyway. Says you guys, what? Why would I not want to do a mock exam? So let me know in the chat box, guys. Yep. Everyone here is saying this. Okay, very, very good. Very, very good. And I can see lots of people are also answering the correct answers here as well. Most people are getting the answer's correct going through it. Yeah, everyone here is saying B, or not B. What? It's not even the right question. Everyone here is saying, everyone here is saying yes. I'm very happy today. I don't know why I'm so happy. Maybe because I'm teaching people OET on the official OET page and helping you guys with your reading part B. Excellent, guys. I'm so happy to see people are ready for their exam, ready for their quiz, their mock exam today. What's going on? I can't think straight. Anyway, guys, also, if you are enjoying this class today, let me know in the chat box, guys. If you're on our Facebook page, give us a like, give us a love heart. Make sure you follow us. If you're on the YouTube page, also give us a like. Make sure you subscribe to the channel by clicking on the bell, as we have live classes every Friday with the official Swoosh English channel and the official OET channel. So make sure you're following both of those pages to get more OET content from Swoosh English and from other providers as well. So please do so, and then we'll get going with the mock test today. Let's go. All right, guys, mock exam extract number 1. So, guys, the timer doesn't seem to be working here. Let me just put that in. Why is my timer not working? Oh, there it is. Okay, guys, so I'm going to keep it nice and quick today. I'm going to try and give you all 1 minute to do this. If you need a bit more time, don't worry. Spend a bit more time when we're doing the analysis to answer the question. Just mute me. But I'm going to try and give everyone just 1 minute to do this today. So here's extract number 1. It says, the memo says that staff considering the use of bed rails should blah, blah, blah. Skim through the text, highlight the title, the topic sentence, skim through your keywords, suggest any modals like avoid, needs, absolutely necessary. These keywords might be important, and have a go. I'll be back here in 1 minute to see how well you get on with this first question. Good luck, everyone. Okay, I gave everyone a little bit more time there overall. I'll put this back on the screen here, guys, but let me know what you thought the answer was. Frankie has said B so far. Sharsad has said B. Good number of people saying B so far. Some people are saying C. Well, at least no one's saying A so far, which is good. So that means it might be one or the other. So let's analyze. So we said the memo says that staff considering the use of bed rails should avoid using them until it is absolutely necessary and evaluate the needs of the patients on a case-by-case basis. Let's have a look at the answer to this one. So those who got C correct, well done. The answer is, in fact, C. And here is the reason why it is so. So it says here, the DQA encourages a review of practices for initiating the use of bed rails and suggests that each patient should be assessed individually. This is why the answer option is C. So that is really, 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 really important. Now, it does mention here in this section that there can be problems with using these rails, but it doesn't say absolutely necessary. It says there can be problems. It doesn't say don't use it unless it's absolutely necessary. So once again, looking around key words and ideas here. C is clearly expressed, B is not, even though it does say problems with them using bed rails, but nothing about them not being used unless it's absolutely necessary. Well done to those who got C correct. Extract number 2. The extract about the use of patient-controlled analgesia with pediatric patients stresses the need to make sure they understand its aims and limitations, involve family members in dealing with any problems, report any instances of misuse to the appropriate staff member. Once again, guys, read your title, read your topic sentence, analyze your keywords, look at words which suggest shades of meaning. Make sure you're reading for complete ideas, not just for words, and analyzing which one makes the most sense. One more minute, guys. Good luck. Hope you get this one right too. Okay, guys, how'd you get on? Let's throw your answers in and then see what we think the answer was. A lot of people are saying A so far. S. John and Frankie and Tawheed Citizen has said A. Let's see if we've got other answers. A lot of people are also saying A in the YouTube feed and on the Facebook feed. Yep, a lot of people also saying A. So I really, really sincerely hope that A is the correct answer. Let's analyze it. It is A. Well done to those. Good work. So make sure they understand the aim. They understand its aims and limitations, all expressed here. Children should not be told to expect complete pain relief, but instead to use the PCA to reduce pain to a level where they feel comfortable. They should also be aware how the PCA stops getting too much pain relief medicine. The pain management service can provide further advice and assistance with any issues that may arise. So this is all implied here. B and C are not implied the exact same way. Well done, guys. Number 2. Let's have a look now at number 3. What is the purpose of the notice about use of language in emergency rooms? A, to pass on complaints from service users. B, to respond to an unacceptable number of errors. And C, to prevent potential miscommunication among staff. Same technique as last time, guys. Let's see if we can get this one correct as well. 1 minute. See you all soon. Good luck. Okay, well done, guys. Let's see what we think the answer to this one is. Oh, let's see. Well, people are saying C is the answer so far. Hope it's right. So we have Suchita has said C, Tawheed has said C, Darla C, Cine C, Hensi has said C, Manjula has said C, and VP Priya. A lot of people are saying C. Let's sincerely hope. A couple of people are saying B as well, but C seems to be the clear answer. Well done. C is correct. So it says here, to prevent potential communication amongst staff. So use of such language can cause confusion and may mislead many young attending physicians, therefore increasing the likelihood of error. So they don't want there to be any communication amongst staff. That is the reason why the answer is what it is. It doesn't talk about any complaints of service users. Most people saw that. And it doesn't talk about, well, it does talk about errors, those who thought it might be B, but it doesn't say anything about them being unacceptable. It doesn't say the number of errors that I've had are unacceptable. We shouldn't have them. So based on that, C is the best fit and the best answer because of the sentence here. And it most likely corresponds with that. That's the one that joins up with it. Well done to those who got C correct. Question 4. According to the email, a GP wishing to refer patients to the RAOC should check that they meet certain criteria, advise them to contact the clinic directly, and C, arrange for an assessment the following day. Good luck, guys. 1 minute. Hope you get another one correct. And that is time. Guys, throw in your answers. What do we think was the answer based on this one? Some people here are saying C, C, C. C says people on the YouTube feed and students on the Facebook feed. Some people are saying B. Want to make sure that we're actually all okay. No, maybe we're getting B is correct. Okay, we've got a mixture of this answer options this time. Let's now have a look and analyze which one is which. So the answer to this one is in fact A. According to the email, a GP wishing to refer patients to the RAOC should check that they meet certain criteria. Let's have a look at this text box here. Concentrated electrolyte solutions must only be stored in the pharmacy department and the locked cabinet trolley. The names and strengths of the medication must be verified by 2 qualified members of staff before being administered to the patient. So one thing, checking that they meet the criteria, that the strengths qualify for them. The dose is to be prepared just prior to administration as per doctor's order. The medication strength and dose are then confirmed by reference to the patient's record. Following the procedure will guarantee optimal safety for patients, as well as providing a safeguard in the event of accusations of negligence. So that's why they meet the certain criteria. The strengths, the medication, and the dose, and that everything is safeguarded as well. All of that alludes to A. B, advise them to contact the clinic directly. There's nothing that mentions them to contact the clinic directly. And C, arrange for an assessment the following day. Nothing mentions there that they should go the next day to get an assessment. That is why A is the correct answer based on your understanding of all of that. Okay, now 5. According to the memo, GPs with patients attending as outpatients should provide them with access to the new service, inform them that letters will no longer be posted, ensure that they are aware of the new arrangements. Okay, memo to all local GPs, patient email service. Have a look, guys, and see if you can get this one correct as well. Good luck. Okay, guys, let's see question 5. How did we get on for this one? I'm just seeing people's comments, by the way, and some people are saying the passage was wrong. I apologize if that was the case. Maybe there was an error in creating that PowerPoint there. So yeah, maybe answer C was the correct option. And I apologize to those who got the who were reading the incorrect passage. We'll make sure that doesn't happen again. So guys, what do we think the answer was to B? Let's have a look. Number 23. Some people are saying B. Some people are saying C. Some people are saying C as well. A few people are saying A. So a bit of a mixed bag, this one. But C does appear to be the main answer that people are saying. So let's look at the answer to this one. It is in fact C. Those who got it right, well done. So according to the memo, GPs with patients attending as outpatients should C, ensure that they are aware of the new arrangement. This is a GIST style question, a classic GIST, and it's all in this paragraph. This new patient email service to open all patients who are registered with a GP in the area. That means they can receive information directly through their email inbox rather than through the post. So once again, a new arrangement. We're making them aware that they will get an email inbox than through the post. Everything here talks about that and how it's much, much, much more important. So B is not the answer, and format letters will no longer be posted. Now, don't forget, that is not the case because it says here the service is optional. So optional means that people can choose to get an email or to get it through the post. So it's not the case that they will no longer be posted. And that is why B is not the correct answer, even though it's alluded to in the topic sentence. Remember, still read around ideas, guys. Very, very important. The next sentence says that. Classic distractor option right there. And then provide them with access to the new service. A was not correct. It does tell them how to do so, but it wasn't the main point. Okay, last one, guys. Number 6. The extract from the clinical guidelines say, before the end of the procedure, patients should arrange any tests that may be indicated, be given as much information as is available, and identify a relative or carer who will accompany them. Good luck, guys. Let's see if we can get, well, 5 out of 5 today because there was a mistake with one of the questions. So good luck, guys, and hope you do well. See you soon. Okay, guys, last mock question for the mock exam. Let's see what we got. Lots of people here saying B, 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 B. Okay, people are saying B. Fantastic, fantastic. Okay, good, good. Let's hope that we're right. Some people are saying bonus round, amazing. Yeah. Okay, guys, so the answer option to this one was B. Be given as much information as is available. Now let's have a look at the first paragraph, which suggests this. It's right here. So, patient selection, pre-assessment and preparation. Patient information sheets explain the procedure and sedation techniques available should be provided on booking to give the patient time to digest the information. If possible, the date of the procedure itself should be given to the patient when they attend the clinic. Selection criteria for sedation should be determined by the specialist performing the procedure and should be explored with the patient to avoid cancellation. So basically all that information in the first paragraph talks about be given as much information as possible, as you can see through that information. There's nothing really mentioned about arranging any tests that may be indicated, and nothing really to identify a relative or carer that will accompany them throughout that. It may be alluded to, but it's nothing precise, okay? the day before, this is what should be done. So it follows a sequential order. Okay, guys, that comes to the end of the mock exam. There were only 5 today. I'm sorry about that one that there was a slight mistake with. But let me know how you got on with the test today. Did you get 5 out of 5? Did you get 4 out of 5, etc.? Frankie got 4 out of 5. Well done, Frankie. Nice work for that there. Let me know how you got on and how you got on overall as well. Hope everyone did pretty well with that. Let me know. Okay, yeah, 4 out of 5 is a respectable score. Fantastic. Some people here are saying 4 out of 5 as well. 4 out of 5 is a very, very good score. We'll say 5 out of 6 in the real exam. And that's what you should be aiming for with your reading part B. 6 out of 6 got Alexi. Well, hopefully 5 out of 6, 5 out of 5, 5 out of 5. Fantastic, guys. A lot of people here are getting really, really, really good scores overall. Nice work. So if you got 4 out of 5, fantastic score. Well done today. I can see that the technique that you used today seemed to work and you found the class quite useful. Let me know in the comments, guys, if you found the class quite useful. But great work on doing so well with your OET reading mock exams today. Nice work. So just a reminder, guys, that make sure you learn the format of the exam, skim the text, look at the detail, the gist, or the main point, highlight your key answer options to improve your accuracy, make sure that you're eliminating the incorrect answers as well as ascertaining the correct answers. Make sure you're reading around for ideas and not keywords. Give the best answer option based on your analysis. Be aware of those distractor options. We saw a few today, as well as words and key phrases which might show inferences, your modal verbs, your adverbs of frequency, etc., because they are key to understand the text overall. And once again, guys, practice makes perfect. It does. So guys, the next class that we'll be hosting will be our OET mock speaking practice class. We do alternating class of reading, speaking, listening, speaking, reading, listening, speaking, listening, etc. And that class will be on Friday, 16th of July at 9 a.m. UK time. I've always got a great turnout for the mock speaking classes, so make sure you attend that next week. We'll love to see you there for a chance to do some role play practices with me. And as I said as well, guys, thanks a lot for coming along to the class today. If you're still not a premium preparation student and still looking for someone to help you pass your OET exam the first time, well, we at Swoosh English have got you covered. We have lots more mock exam classes like that, mock exams, writing corrections, expert OET teachers with great feedback. And if you're looking to come on board with us at Swoosh English, we're offering you 20% off today for signing up to one of our preparation courses. The first 15 signups only, and it's only valid until Sunday midnight UK time. But big savings potentially today for coming on board with us. What do you need? Well, you just simply need this discount code. The code is enter code OET Live Chat 20 at www.swooshenglish.com, and you will get 20% off your OET preparation course. Just enter code OET Live Chat 20 for 20% off your OET preparation courses. They are selected courses and more information online about that. Check the comments, guys. Some more information about that code is coming through, as well as packages that we recommend for you. If you've got less than a month, our intensive package is just for you, as you need intensive preparation. You've got a bit longer and you haven't booked your exam yet. You're still thinking, right, I need preparation and help, but I'll take it whenever I'm ready. Our deluxe course is perfect for you as well. Guys, I don't normally do this, but I'm willing to dedicate another 5 minutes or so of this class for you to ask me any questions about your OET preparation today, about some of the class techniques and tips today, about us at our Swoosh English preparation courses. So I'm here for another 5 minutes, guys. I know the class is over, but I'm willing to do a brief Q&A with people here today. If you have any questions that you want to ask me about your OET preparation, about our courses, about the class we did today, etc., etc. So make the use of these 5 minutes, guys, and text in some of your questions to me in the boxes. Now, I won't get a chance to answer all of them, I'm sorry, but if you do have any more questions at the end of the session I don't get to answer, then please send an email to inquiries@swooshenglish.com, and our dedicated customer service team will be more than happy to help you out with some questions about your OET preparation. So guys, yep, thank you very much. You're very, very welcome. I'm glad to see that so many people have enjoyed this session today. Hope that you find it really, really useful. But if you've got any more questions, guys, I'm here. Please ask me a couple of questions about your preparation. So Miss Baz said, where can we find vocabulary relevant to the OET? So Well, preparation courses for one, MISPA will be a very, very good source for you to get vocabulary relevant to the OET. Most of you guys will know your medical jargon and vocabulary very well. It's all about using the appropriate vocabulary to express yourself in the speaking section and in the writing section. Of course, there are lots of resources online, but it's best to get all of that with a preparation course, and that's where we can help you out, MISPA. Come and join one of our courses. All of our classes go through relevant vocabulary for speaking, for reading, for writing, and for listening, and that's how we can help you. Adeza has said, is 1 month prep enough for me to pass the OET exam? I'm just going to go myself full screen here. Adeza, it really, really depends. If you are scoring C pluses or above in your preparation at this point, then you could be ready in 1 month's time. But if you're going into the exam blind and you don't know exactly where you are in your OET scoring at this point, then you could be ready, but you also might not be. It depends if you are willing to take a gamble and take your exam, or are you sure you're going to pass? So if you booked the exam already, then of course you have to go for it. Prepare for your exam. But I always recommend anyone who's taken their OET exam to not book the exam first and then prepare for afterwards, especially if you've got less than a month. Rather, prepare for the exam in advance. Know you're going to pass the exam, or got a high chance of passing the exam, because your teacher will have told you, your mock exam feedback would have told you, your writing correction scores, etc., will have told you, and then you're ready to take the exam once that happens. But the short answer to that question, my friend, is if you're not ready, you can be ready if you prepare adequately. And our Swoosh English intensive course is recommended for you. You'll see it there in the chat box, my friend. Make sure you have a look at that intensive course. It's a 1 month preparation course designed for someone who has a month and wants to give themselves the best preparation. So a short-term course will be the best for you, my friend. Vignashila said, will I be penalized if I don't finish all the role play tasks in the speaking? Yes, you will be. You really want to try your best to try and finish that role play within approximately the 5-minute time. So it's all about your time management. It's all about making sure you're concise enough, you're flowing through the role play, and your structure is very good, Vignashila. After all, you wouldn't be doing very well in the role play in a doctor's consultation if you were cut off in the middle of it and didn't come to your satisfactory conclusion. So it's very important for you to do your exam, to finish that role play in that time, my friends. Okay. Labashit said, listening part is tough for me. Suggestions, please. Join a preparation course, my friend, where you'll go through tips, methods, great examples. You'll get more advice like we did today in the class about how to go through the class, how to apply that to your listening parts. So I make sure that you prepare for your exam appropriate, Labashit, and I recommend, of course, that you have a look at one of our preparation courses, as we'd be very, very happy to help you out with that. Okay. Anyone who's asking about, I'm struggling with listening, I'm struggling with speaking, I'm struggling with writing, I'm struggling with my reading, what can I do? I can't answer that today because I don't know exactly what you're struggling with precisely. Get an expert to help you. Come over to us at Swoosh English. We'll be more than happy to help you out with our very affordable preparation packages to help you pass your OET exam the first time. After all, you can get 20% off our preparation packages, where you'll get classes like this and more. They'll help you get to a B in no time with your preparation. So come along and have a look at this. Janine said, are we allowed to write on the test booklet? Yep, you can take some notes down on the test booklet. That's absolutely fine. Not a problem. Rekha has said, tomorrow I have my exam. Rekha, I wish you the best of luck with your exam tomorrow. I hope you're going really, really well with it. And best of luck from us at Swoosh English for your test results. And I hope you do really, really well in it tomorrow. Okay. All right, guys. I'll just answer a couple of more questions here. I'll be very, very happy to answer a couple more of your questions. Okay, Paolo's asked me a question here. This is the last question. I'll say, what is the correct way of ending the letter in writing? Is it yours sincerely or sincerely yours? Yours sincerely, but only if you know the name of the recipient of the letter. It's yours sincerely if you're writing to the name. If you're writing to someone who you don't know the name of, then it's yours faithfully. That was an easy one to answer, so I thought I would do that very, very quickly for you. Okay, guys, thanks a lot for a couple of your questions. My short answer to a lot of those is get help, get support, get feedback. If you're in doubt in any way about your OET exam, about your scores, about your performance, then make sure you get help. Make sure you prepare adequately. You don't want to be taking the exam 3 or 4 or more times, as some candidates can do because they haven't prepared adequately for it. It is a C1 level of English exam. Therefore, you have to prove that you are an advanced English level user. And that's where we at Swoosh English can come in, guys. So once again, 20% off our Swoosh English courses for the first 15 signups only, valid until Sunday midnight UK time. Hasn't been a better time for you to get involved with us at Swoosh English. Make sure you enter code OET Live Chat 20 when you come along to our website. The details are at the bottom of the screen with some recommendations that you can do so. Enter code OET Live 20 Chat for 20% off selected Swoosh English preparation courses. We want you to pass. We want you to pass as cheaply as possible and as quickly as possible as well. So guys, thanks a lot for coming along today. I really appreciate your time. Good luck to anyone who's taking the exam in the next couple of days or so. And yeah, good luck and well done for taking part in the class today. Most of you did excellent with the OET reading activities. So once again, thanks a lot for coming. It's been a pleasure hosting this class. Everyone's been so interactive and so involved with the class. That's what I like to see. And I'll see some of you hopefully next week for the OET mock speaking class, 9 a.m. UK time on the Swoosh English and the OET Facebook and YouTube channels. Have a great day, everyone. Good luck with your preparation. Study hard. Keep the dream alive. Make sure you're working towards that OET exam, but you make sure you're also doing it appropriately and you are not frustrated and pulling your hair out because you know you've got this with the confidence and support that you need. Have a good day, everyone. Thanks a lot, and I'll see you all very, very soon. Take care. Bye.